Bismillahirrahmanirrahim. Assalamu alaikum. This is Dr. Ghufran Babar, a physician in America, and you are watching my YouTube channel. I'm back with this week's COVID-19 updates. The past week, again, the mortality because of the COVID-19 continued to rise. In US, now almost 210,000 people have died, with total number of cases to be 7.3 million. India has 96,000 cases, 96,000 deaths, and 6.7 million cases of COVID-19. Brazil has 142,000 deaths reported so far and about 4.7 million cases. So the mortality is still prevalent. Before we proceed towards our updates, please subscribe to my channel, share it with your friends and family, and like this video. Thank you. So based on the current report from WHO, almost 1 million people have died in the world already, and a conservative estimate is that the death toll may rise up to 2 million before the COVID-19 pandemic ends. WHO has put down some guidelines and has issued a statement, and those guidelines and statements include the first one is prevention, and prevention of spread by the rapid spreaders, those people who are gathering in sports events, festivals, large meetings, gatherings, political gatherings. Now the election in US is going on, so the political gatherings will rise and the spread of COVID-19 can happen. Protests of any kind may also be one of the reason for the spread of COVID-19. And of course, students returning to schools, colleges, may get infection, which may be mild, but may spread it to other people. The second guideline that WHO released was protection of the vulnerable population. The vulnerable population include the old, the elderly, the people with coexisting conditions, with chronic diseases, chronic lung diseases, immune suppressive conditions, conditions that need long-term care. People in nursing homes, nursing facilities are the vulnerable population of the society. We did not protect them in the beginning. We must not forget them now. The third thing that WHO stated was education, empowerment, and enabling the communities to deal with this pandemic. So a lot of people are not really educated. They still take it lightly. So it's very vital to continue to spread the word that this pandemic has not gone away. The monster is still there. The cases may have died down in certain areas, but they can increase at any time. So education is important for the people, and then giving them the resources to work on prevention like quarantine, getting themselves tested, and getting the right treatment. And if you find the fourth thing that the WHO said, that find, isolate, test, and care for all cases. So anyone who has the symptoms, who is tested positive, must be isolated. They must go into quarantine. And that's how you will be able to control this pandemic. You trace that positive case, and then you go to that specific community. You isolate them from rest of the country, rest of the community, so that the spread of the virus does not occur. And the same model was used by Italy, so that now the new cases have decreased in Italy. So we have to use this model to trace the cases, to isolate them, so that the spread does not happen to rest of the community. Vaccines, diagnostics, and therapeutics are very, very, very vital, and there is ongoing research on all of them, and WHO has proposed Access to COVID-19 Tools Accelerator, which is ACT Accelerator. Access to COVID-19 Tools, or ACT Accelerator, which should be spread to low and middle income people all over the world. Deployment of these tools to eradicate the disease globally. Unfortunately, the funds which are given to the underdeveloped world, they may be mishandled, and they could be used up by the people who are corrupt. So the people who are low income or the grassroots people do not really get the help. So hopefully this menace of corruption could be eradicated in all the underdeveloped and developed countries. So WHO says that the goal for ACT Accelerator is to deliver up to 2 billion doses of vaccine by the end of 2021, which is about 15 months away. And 245 million courses of treatment should be given, a treatment like dexamethasone, which has been shown in randomized controlled trial that it could be useful for oxygen dependent or ventilator dependent patients. 500 million diagnostic tests, that's another goal for WHO, to have that many tests available all over the world so that this disease could be tested and cases could be isolated and prevented from spreading it to the other people. And remember, everyone has to be vaccinated to eradicate this illness from the world. And no one will be cured until everyone is cured. So you cannot be selfish. The developed world cannot be selfish, because the disease can come back to them if it is not eradicated globally. There are 50 other tests that WHO is working on, and hopefully these tests will be able to minimize the time from the time of test to the time of result. The medications which are being looked at, like dexamethasone, vitamin D, and others, up to 1,700 clinical trials are going on, and so far dexamethasone is the only proven medication that could be used in seriously sick patients to prevent death. So only D for D, dexamethasone, for prevention of death. And COVAX, that is the vaccine against the coronavirus, should be developed. The developed countries are signed up. They are ready to receive the vaccine as and when it is available, but it has to be spread to the low income countries, the poor, the underdeveloped countries, so that the disease could be eradicated globally. The amount of money for this ACT, which is the access to COVID-19 tools, access to COVID-19 tools is the ACT Accelerator. $35 billion are needed. So this is the amount of income that the developed world has to come up with to eradicate this illness. And up to 2 weeks expense of smoking is up to 35 billion. So if people all over the world don't smoke for 2 weeks, we will raise 35 billions needed to help eradicate coronavirus disease from the world. Going to the European, data, UK has 42,000 deaths and 4.4 million cases. France is up to 32,000 deaths and 5.4 million. Spain, 31,000 deaths and up to 0.75 million cases. Italy, 36,000 deaths, up to 3.1 million cases. Pakistan has 310,000 cases so far, with 6.5 thousand cases of death approximately. So CDC sent out a report from May to August, which stated that in the beginning, the disease was more in the old people, like I said earlier, in the nursing homes, in the sick, in the elderly, people with secondary conditions. Then from June to August, it went to young people greater than 20 years, and that also contributed to the spread to the general community because they would go out in the community and give the disease to other people. So prevention, 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 that is the way to go. Prevention by mask wearing, social distancing, hand washing is very important. Isolation of cases, quarantine of the cases, quarantine of the communities so that rest of the countries don't get it. And similar things were utilized by UK. Isolation of communities in Newcastle, in Glasgow, Leeds, Leicester, Manchester, Birmingham, Cardiff in South Wales. All those communities were isolated. Thousands of students are being affected as they return to college and they don't practice preventive measures and give it to other people. So it is not a bad idea to keep yourself isolated from your loved ones who are elderly, not to give them the illness. Patrick Boet, who is a French epidemiologist, he said that there will be lots of cases coming this winter, which will be a very, very, very important phase in COVID-19 disease, because lots of cases would be present, would be spreading during the winter months, because people would be more in closed doors. Keeping the doors open would be hard. Closed group gatherings would be present, and the other illnesses which also come, like flu, and in kids RSV virus as well, with coughing, and super added COVID-19 could be disastrous. So let's hope that the world can come together. Prime Minister Imran Khan from Pakistan said that world has to develop a unifying policy, has to come together to utilize the resources so that this pandemic could be eradicated from this world. Please stay safe. May Allah bless you and your families. Please subscribe to my channel. May Allah bless all the communities, all the world, to get rid of this pandemic. Ameen. Sallallahu alayhi wa alihi wa sahbihi wa sallam. Assalamu alaikum.